Hello, everybody, and welcome to the IHME Post-Bachelor Fellowship online information session. My name is Sean Lassiter, and I am the Education Program Manager here at IHME. Joining me today is Ruben, who is a Post-Bachelor Fellow in his third year, and Andrea, who is a Post-Bachelor Fellow in her second year. This information session is intended to provide candidates who are interested in applying to this program with an overview of IHME, an overview of the Post-Bachelor Fellowship Program, information on how to apply to the program, and then an opportunity to ask questions and hear from current Post-Bachelor Fellows. We encourage the audience to submit questions throughout the presentations through the live stream link or any social media, and then at the end of the presentation, we will answer all questions possible. So let's get started. Institute for Health Metrics and Evaluation is an independent research center identifying the best strategies to build a healthier world. IHME is located in Seattle, and we are a research institute at the University of Washington. Through our research, we strive to provide accurate and comprehensive information on population health to build a stronger foundation for strategic decision-making and ultimately better health for people worldwide. Our research is organized around answering three critical questions. What are the world's major health problems? How well is society addressing these problems? And how do we best dedicate resources to maximize health improvement? To these questions, we focus our research on four areas: maximizing health, tracking performance, maximizing impact, and innovative measurement systems. These areas is made up of topic-specific project teams, of which there are approximately 18 at IHME. And I encourage you to visit our website to learn more about the specific work of each of these teams. Research that IHME produces and that Post-Bachelor Fellows contribute to has received international attention. I'd just like to highlight a few examples here from our GBD study 2010. The New York Times has used our research on air pollution in a story about premature death in China. The Australian Geographic has featured our research on malaria in a story they did about global malaria burden. BBC writes about data visualization tools created for the GBD study and how they are changing the way people interact with health data. First Lady Michelle Obama touts research we did on physical activity and obesity for her Let's Move campaign, and this is in July of 2013. And the Indian newspaper, The Hindu, uses GBD numbers in a story about health outcomes in India, comparing them to health outcomes in neighboring countries. PBF program at IHME is a structured health research program. Individuals can apply their knowledge and passion to advance the field of health metrics and accelerate global health progress. This program helps to cultivate talented young professionals to become future leaders in the field of health through an improved understanding of the connections between high-quality information and improving health around the world. This program focuses on preparing fellows for future positions in a wide variety of careers, include academia, national health agencies, international organizations, foundations, and private and public businesses. To achieve these ends, there are four specific objectives of the PBF program. We want to strengthen individuals' quantitative and analytical skills to understand, develop, and apply sophisticated analytical methods. We want to cultivate an individual's capacity to perform high-level, independent research which is rigorous and sophisticated. We want to improve individuals' understanding of the global health landscape, its major challenges and current issues. And we want to provide a mentoring and ongoing learning environment for fellows. The PBF program starts each year in September. It is a 2 to 3 year program. The program offers individuals the option to pursue a fully funded Master in Public Health through the University of Washington. And it incorporates close mentorship and advising from renowned researchers in global health. The PBF program is at the intersection of research, education training, and a professional position. at IHME are involved in scientific, empirical investigations of health in various capacities. It is this participation in actual research that bolsters the PBF's understanding of the research process. So how one goes from a hypothesis or question, data collection to analysis, application. And being involved in research is really on-the-job training, which provides PBFs with the opportunity to apply the skills and knowledge they accrue through the other structural elements of the program. I'd like to reintroduce Ruben Connor and ask about the research that you're currently conducting, what impact you feel your work has made toward improving health.
All right, thank you, Sean. So I'm working here at IHME as the ABCE project, which stands for Access, Bottlenecks, Costs, and Equity. And the project has done a health facility survey in multiple countries, so going to everything from really small health posts to large hospitals, both private and public, in, let's see, India, Colombia, Zambia, Ghana, Uganda, and Kenya so far. So pretty diverse set of countries, and we've collected data from all these places, and we're now sort of moving into the part where we analyze the data and try to come up with policy-relevant recommendations for the countries based on what we saw. So to take an example, I guess, we collect a lot of data on the finances and the output of facilities, so the number of patients that they see, that type of thing. So you can kind of look at that and then see which facilities are doing well in terms of seeing a lot of people, which facilities aren't doing as well and are less efficient. And then you can look at a wide variety of other things as well, such as which facilities are doing vaccinations, which facilities are have the equipment they need, which facilities have the personnel necessary, all that type of thing. And so I think the main way that I've seen impact from that work so far, this last summer I was in Zambia for the PBF practicum, which I think Sean might mention later. But it's I was there for a couple months and got to see sort of the dialogue around our research. So got a chance to see Ministry of Health officials talking about sort of what our results meant and how they could change the health system based on what we were finding. So that was really satisfying to see, you know, data that I'd looked at being put into the hands of officials and then them making decisions based off of that. Yeah, pretty exciting.
All right, thanks, Ruben. So now I'd like to jump back to the presentation and talk a little bit about the education and training activities. Foster PBF's development of research skills and knowledge within global health. The PBF program is composed of formal and structured educational activities that are really designed to facilitate an ongoing learning environment and diverse learning opportunities that really contribute to fellows' overall evolution as a researcher in global health. And we really see these education and training activities as mechanisms which introduce fellows to the concepts, software, and methods which they can later apply to their research. The education and training activities also include broader training and skills beyond research. For instance, PBFs participate in workshops on presentation skills and also broader professional skills building. The Post-Bachelor Fellowship contains 7 specific activities. The first is the IHME Fellows Training Camp. And this is where fellows really begin the program and start to learn about global health. This is an intensive 2 to 3 week training camp and is designed to familiarize new fellows with current global health issues and their analytical challenges. IHME Track Seminar is an opportunity for Post-Bachelor Fellows to meet and discuss an article about a current global health issue. And the purpose is to really teach fellows to think critically about all aspects of a research question, from the quantitative methods employed in the study to the results. IHME Seminar is a lecture series where guest speakers are invited to come to IHME and give a talk about their work. The lecture series really exposes fellows to the breadth of research occurring in the field of global health. Club Seminar is an internal lecture series for the IHME research community. And it's really an opportunity for fellows to present developing work and an opportunity to receive feedback from their peers and their mentors. Methods training workshops are instructional lectures or exercises that are focused on training fellows in specific quantitative methods or statistical software. And these workshops typically occur once each academic quarter. PBFs take classes at the University of Washington, which are relevant to their education and training in global health. And again, these fellows take courses, one course each academic quarter. And an important component of the PBF program is a research abroad experience. And this is where second-year fellows travel abroad to live and work, location where data are being collected and public work is being taken in the field. At IHME, PBFs conduct work in a professional capacity. PBFs are considered full-time employees. They work 40-plus hours a week. They have specific roles and responsibilities. They have deadlines for their work, participate in conferences, and they present their work to stakeholders. And this helps young individuals who've just recently graduated from college to navigate a professional environment and also develop competencies outside the technical skills and knowledge that are meaningful for successful performance as a researcher at IHME or in any professional capacity. The PBF program contains a strong emphasis on mentorship, and we define mentorship at IHME as providing continuous coaching and guidance to assist fellows' professional, personal, and career development and unlock their natural ability to perform, learn, and achieve. And we view every interaction between any staff member and a PBF as an opportunity for mentorship and direction. PBFs are assigned a faculty advisor who oversees their work, but also provides professional and personal development. Faculty advisors help fellows develop competencies for successful performance as a researcher, as well as help identify pathways for success after IHME. PBFs are also eligible to pursue a fully funded Master's in Public Health in Health Metrics and Evaluation through the University of Washington's Department of Global Health. The MPH degree curriculum is composed of a set of core requirements, track requirements, electives, a practicum, and a thesis. The coursework is highly interdisciplinary, and PBFs take courses from across campus with the concentration of resources from IHME. If fellows pursue the MPH degree, the PBF program is extended to a third additional year, with graduation occurring at the end of the third year. PBFs who apply to the MPH degree must seek admission to the Department of Global Health's MPH program and meet the University of Washington Graduate School criteria for admissions. Applicants to the PBF program are not required to apply to the MPH program simultaneously. Through professional work with progressive on-the-job training, academic research, education and training activities, coursework, field experience, and mentoring from a group of renowned professors and researchers, individuals can benefit from the PBF program in the following ways. Becoming an expert. Fellows develop expertise in a particular subject or topical area in health, and also become authorities of a particular part of the world. Becoming a researcher. Acquire the skills to conduct high-level, independent, and rigorous research. Through the PBF program, individuals develop the ability to define strategies for investigating a research question and use their creativity to develop innovative solutions to complex problems. Becoming an analyst. Fellows accrue a host of quantitative and methodological skills that can be applied to manipulate and manage data. Becoming a programmer. Fellows bolster their technical competencies to program and code in multiple statistical software programs. Becoming a professional. Fellows strengthen their professional experience and profile through skill building, publications, a dynamic work experience, a range of coursework, and potentially an academic degree. I'd like to reintroduce Andrea Stewart and ask her about what benefits you feel you've gained while working as a PBF at IHME, And then what's the one most important thing that you feel you've learned?
So I feel like a lot of the components that Sean's talked about of the PBF program, I've benefited from greatly during my time as a PBF. In particular, the mentorship and the interactions I have with world-renowned faculty have really improved my performance at work and have made me a more effective researcher in experiencing actions and watching those researchers. In addition to that, I've also gained professional skills in presenting and communication. So I presented at 2 conferences this year, and IHME provided me with excellent training in presentation skills that I will continue to use throughout my career. So those 2 benefits of the PBF program, I would say, are very important to me the past 2 years, but the most important thing I think I learned at IHME is how to interact with people from diverse academic and cultural backgrounds. And that's something I continue to learn, and I think that's a big benefit from the PBF program.
Thanks, Andrea. I'd like to talk a little bit about the trajectories of our fellows after the PBF program. Fellows that go on to pursue medical school. We have others that go on to pursue further graduate training, either in another master's degree or enrolling in a doctoral program. We have others that work domestically in the United States in the area of health. And then we have others that go to work at the international level in a field or with an organization that's related to health. So the basic requirements of the PBF program are that you must be a United States citizen or resident to apply. You must hold a bachelor's degree and have no previous graduate training. You must have strong analytical skills. You must have an interest in research and global health. And I should mention that we do not require any applicant to have a background in global health or any related field. So how do you apply for the PBF program? It's fairly simple, and we require the following materials: a resume, personal statement, which is a 500-word maximum on how your skills, experience, and long-term career goals contribute to your candidacy. 1 letter of recommendation, and we feel it's best if the letter of recommendation is from a professor or a professional who's familiar with your coursework or research, and an official academic transcript. And you could apply to the program online through our website. So the application review timeline is as follows. Deadline is January 15th, so less than a month away. All candidates will take an analytical thinking exercise between January 20th and January 24th. And you could find more information about the analytical thinking exercise website. All applications are reviewed after everyone has taken the exercise, and that will be between January 27th and February 7th. Interviews will be conducted at IHME in early March, and job offers are awarded by April 11th. Candidates typically have 2 weeks to accept or decline our offer. So that concludes the presentation portion of the online information session. We would like to thank everyone for their attendance. We'll now open up the session for your questions. And Ruben and Andrea are here to answer any questions that you may have for them. No questions?
I think one thing people are often curious about is what it actually looks like to be a post-bachelor fellow on sort of a day-to-day basis. A lot of what Sean talked about was sort of pretty high-level stuff. I think it's worth knowing that you do spend a lot of the day working on a computer. It's a lot of working with code and sort of trying to understand models, a lot of yeah, pretty computer heavy work, I guess. But I don't know. It's kind of like milking a cow, I guess. It's a little bit hard to explain what it is until you're actually there. It's pretty, yeah. I think if you haven't been involved in research before, I certainly liked it. I certainly found it interesting. But it is a little different than other jobs you might have had.
I'd like to talk about the classes that the PBFs take. So each quarter, in addition to the PBF seminar and the IHME seminar, PBFs take a class at the University of Washington. And this can be in a number of departments and a number of subjects, and great way to expand your knowledge outside of work. And I wanted to talk about a class that I took this past quarter, epidemic modeling of infectious diseases. I learned a new software and new concepts that will definitely apply to my career later in the future. So not only do we get excellent education and training here at IHME, we also get great experience with classes at the University of Washington.
The question is, what are some things that will make your application stand out? Should be mentioned that we review each application on a case-by-case basis, and can review each application on their own terms. Things that will make your application stand out: it's a well-written personal statement. That's something that I think we definitely look at very heavily. So it's important to express your interest in the program, how you feel your background, your skills and knowledge contribute to your fellowship at IHME, and also what you hope to get out of the fellowship program. And then also the letter of recommendation is something that we look at very heavily as well. And I would just recommend that you get a recommendation letter from someone who could speak to your ability to succeed in a high-level, dynamic academic environment. So those are two things that I would say could help kind of strengthen your application. Okay. So yeah, so the question is, what are some examples of the actual trajectories that people have, or organizations which are working for now? In terms of graduate school, we have those who are in doctoral programs in health services at the University of Washington, at Harvard University, or attending medical school at Dartmouth. We've also had individuals who have pursued, just gone straight to another professional opportunity. We have individuals who are working at PATH, which is another global health actor in Seattle, and they're working as a monitoring and evaluation specialist. We have had individuals or fellows who have gone on to work at the Gates Foundation as a consultant. We have individuals who have worked in India with the Indian Public Health Institute. They've worked as kind of a program manager and a researcher and data analyst there. So those are some examples of what PBFs have gone on to after the fellowship. The question is there a GPA requirement? And there is no GPA requirement to apply to this program.
I wanted to hop in for the first question about the application stuff. Obviously, I'm not involved in that. I've gone through the process. I know that it's a little bit nerve-wracking for PBFs applying, and it's something to worry about. I would just say, try not to stress about it too much. Mr. Sean P. Laster here knows when a candidate's good and when they smell like trouble. So I think you'll just have to try your best.
So the question is, what is the overall working experience at IHME? And Andrew, do you want to?
The overall working experience at IHME is unique in that this is a really young and fast-growing institute, and the work we do is so cutting edge that everyone is just so excited about the work they're doing every day. Even though the work we do is really hard and really quantitatively intense, being around all of these people who are so passionate about what they're doing makes it an incredible place to work.
Just to add on to what Andrea was saying, I think it's important to mention that the PBF program can be an intensive program. And when I mentioned that PBFs work 40 plus hours a week, they typically work probably between 45 and 50 hours, maybe on an average week. It's important to recognize that this is a fairly intensive program, and we really think of it as really like a residency program in global health. And you're learning and you're working at the same time in a rigorous and kind of dynamic work environment. But I feel like that type of structure and environment really helps accelerate the learning process for fellows. Really helps them develop some really true competencies in health research. Question is, since there's no GPA requirement, but is a high GPA an important aspect of your candidacy? And the answer to that question is no. We, like I mentioned earlier, we try to look at, we look holistically at each applicant. And, we're really looking for kind of who are strong analytically, but are also a great fit to the organization. And we're really bringing on a cohort of individuals. So people who have a range of skills, some people who are great programmers, some people who are great at math, some people who have interest in economics and health services, have other types of interests. We really want to bring on a diverse group of individuals, not just looking to bring on the candidates who have the top GPA. So I hope I was able to answer that question.
So Sean mentioned the boot camp, and when you first come to IHME, you spend, I think it's 3 weeks, sort of learning about all the projects that there are at IHME, a lot about how to code, what's expected from the job, that kind of thing. But during that time where you're learning about all the projects, it's sort of your chance to start thinking about which of these you actually be interested in and which you can sort of imagine yourself doing. And then you don't necessarily get to like pick your project. I think most of the time people end up finding a really good match, and so you sort of get to have some say. And I guess I'll filibuster by just saying that I actually really ended up being very happy. I don't know anybody that has been unhappy with the project they've worked on. So yeah.
Yeah, so I actually work on the verbal autopsy research team, and if you want to learn more, I would suggest going to the IHME website because it is a really interesting topic. And I actually had mentioned in my interview that I was interested in the verbal autopsy research team and working on verbal autopsy at IHME. So, showing enthusiasm in your interview for a specific team, if you're interested in it, and just in IHME in general, is definitely a plus.
Is how many people are let into the PBF program each year, and we're looking to bring on 10 to 12 new fellows. The question is, what is the interaction like between their PBF cohort? And I will let one of you guys answer that question.
So I'm really glad that this question, because we haven't really talked a lot about the cohort aspect of the program and how you come to Seattle, you come to this new organization, and you have 10 kind of colleagues who are also your age, who have the same interests as you, and who are just as passionate and smart about mental health. And that's definitely a huge benefit of the PBF program, and something that I have benefited from greatly. And not only my own cohort, but the cohort above me and the cohort below me, since I'm a second year there too. And I get that added benefit of having mentors who are all around me, who can help me through problems, and also able to mentor myself, the younger PBFs who are below me. So it's just, I can't speak more highly about cohort and the PBF aspect.
Sort of as a, I guess, illustration of how fun the program can be, there's something we do called Lunch Club, which is where people all bring in lunch for each other. And that can really be anything. You make it for everybody, and so it can be, you know, carne asada fries or sushi or whatever you want. But I think it's something that really just shows sort of the community that we have here. And I don't know, I really like getting fed by the other people I work with. So yeah.
The question is, what are some other examples of where fellows have ended up after IHME?
We currently have one fellow working down at the Mexican Ministry of Health. We have, I think Sean mentioned most of the other ones. Do you have another one? Oh, WHO. Another one working at a nonprofit in Zambia. And a couple guys over in North Carolina. And I don't actually know exactly what they're doing, but one of them is definitely in a PhD program. So that's good.
We've also retained a few fellows after their post-bachelor fellowship as GBD researchers, and another is working here at IHME on the IT team, actually.
And just to emphasize even more, the fact that the program is 2 or 3 years means that you get out of it and you have your whole career ahead of you, but you also have a network kind of already built in. So really great to know that I have all of these people who have gone through the same experience as I have and will be able to relate to me later down the line professionally.
Question is there a way to connect with PBF alumni after the PBF program? We have a few formal mechanisms. We have a LinkedIn page that's created for PBF alumni, and we tried to post job opportunities to the LinkedIn page and tried to encourage PBF alumni to also post job opportunities which they may know of. We also have a Facebook group that's just for PBFs and alumni. It's another way we try to kind of facilitate interaction between current and past PBFs. Are there any other ways that you guys? Question is, are PBFs available to answer questions for prospective applicants? Yes, PBFs are happy to answer questions or to talk with you individually about their experience in the fellowship program. I would just encourage you to write to us and ask to be connected to a current PBF. And you could email us at training@healthmetricsandevaluation.org. Is probably the best way to connect. Okay. Well, we'd like to thank everyone for attending. If you have any questions, again, you could just send us an email at training@healthmetricsandevaluation.org or pbfs@healthmetricsandevaluation.org. And application is due January 15th.